Hello, everyone. Thank you for taking time to join the Colorado Sun this evening for a conversation on the mental health crisis among kids across the state. My name is Erica Breunlin, and I'm an education reporter with the Colorado Sun. And I'm joined tonight by Brown, who covers mental health and social justice issues. This is an incredibly important conversation at a critical time. In May last year, Children's Hospital Colorado declared a pediatric mental health state of emergency as emergency room mental health crises jumped 90% from spring of 2019. In response, lawmakers devoted more state funds to addressing the mental health needs of young Coloradans, including by offering them screenings and up to 3 free visits with mental health professionals. With help from mental health professionals and from a student from Thornton, teens across the state are struggling with their mental health, what's working to help them, and what more needs to be done. I'm going to hand things over to Jen Brown in a moment to introduce our panelists, but before I do that, I would like to thank tonight's event sponsor, Kids Crossing. I'll give it over to you, Jen.
Thank you, Erica. So we have an excellent group of panelists tonight who are my pleasure to introduce. We've got Dr. Katie Reynolds. Katie is a pediatric clinical psychologist at Children's Hospital Colorado, and we're lucky to have her time tonight. We also have Jayara Shrestha. She is a high school student. She attends Horizon High School in Thornton. She's also an intern with the Colorado Youth Congress. And finally, we have Kris Schell. She's a school-based mental health specialist with Centennial Mental Health Center. Kris is based in Sterling on the Eastern Plains of Colorado. So thank you, ladies, for joining us tonight. I'm going to pitch the first question here to Dr. Reynolds, who I hope can help us set the stage for what we're talking about here tonight. And, as Erica mentioned, there's a pediatric mental health state of emergency that was declared by Dr. Reynolds Hospital. And Dr. Reynolds, could you just really describe for us what's going on? What are you seeing in children who are presenting at the emergency department and in the clinics?
Yeah, great question. So in terms of what we're seeing on the ground, I mean, certainly that really big increase that you all mentioned in that first part of 2000, that first part of the pandemic was really huge. Since then, right now, we've seen a 7% increase in patients coming to the emergency department for behavioral health concerns in the first half of 2022 compared to that before pre-pandemic number. So we're still seeing somewhat of an increase, but not that same huge jump at the beginning. So things are in some ways leveling out, and in others, we still have a huge amount of need. So kids are coming in with concerns, family concerns about depression, suicidal ideation, suicide attempts. Those are the most frequent presenting concerns in our emergency rooms. And certainly what we're seeing a lot of when kids are coming to clinics for the first time, really haven't been assessed or treated for anxiety or depression or other behavioral concerns to this point. And now things are blossoming out of control under the stress of the pandemic. So those are some of the biggest concerns that we see right now, especially when it comes to safety.
Yeah, Dr. Reynolds, I want to stick with you for a moment. You make a really interesting point about how these mental health issues have just blossomed among kids throughout the pandemic. But kids in Colorado have long had a history of struggling with their mental health. So walk us through what the mental health crisis among youth looked like before the pandemic, and then how the pandemic further shaped the crises that was already existing in the state.
Yeah. So certainly not enough providers pre-pandemic. And then you add on top of that, we already have this broken system. And now we just see the influence of the pandemic really blowing that out of proportion. And I think a couple of things are happening here. So one is kids who might have been flying under the radar before now have this additional stress of everything that's happened with COVID, readjusting, re-entering school. Suddenly I'm entering school at a very different developmental time point than the last time I was in school. My relationships are different. My friendship dynamics are different. So all of those things are stressors that probably wouldn't have happened or have escalated to the point of needing intense psychiatric care if the pandemic hadn't occurred. And of course, we also, just thinking about our system before the pandemic, I think one of the things that a lot of money has been poured into in these one-time spending dollars has been more prevention and more supports for our systems of care that were underfunded and under-resourced in the past. So in many ways, we're moving in the right direction. So I'm feeling pretty hopeful, but at the same time, we still need more folks in this field to support the kids that are struggling day in and day out.
And I should add to that too, Dr. Reynolds. Colorado is in the midst of pumping like $450 million into its mental health and substance abuse system. Money from coronavirus aid from the federal government, and there's been many meetings, and there will be many more to come to figure out exactly how to spend all that money. But that's part of the point in having these critical conversations at this time. But next, I wanted to ask Kris a question about particularly school-based mental health care. And as we know, schools, a decade or so ago weren't really in charge of mental health care, but now they all have counselors available and programs. And so, Kris, talk to us about this time of year in particular is quite stressful, the beginning of the school year. And what kind of stressors do you hear about and see in your schools? And also maybe talk about some warning signs for people to look out for, especially in a high stress time like the beginning of the year.
Mm-hmm. Certainly. And I do want to say that not all of our schools have counselors. Some of our smaller schools may not have a counselor at all, or they may have a counselor or access perhaps to some mental health staff, whether that is mental health providers. So just to be aware that there is a shortage of schools have access to a counselor within their building. But I think when we talk about that change from summer routines where we're usually in a much more relaxed setting or social expectations to that structure of a school day, significantly for many. And I think what we see initially is fatigue. There's a difference in the time that we get up in the morning, some of the time constraints that's with to get ready and to get to school on time, and then just the while routines are to our well-being for knowing what to expect and what will happen. It's different as far as expectations. I think fortunately this to meet with a few elementary students and a few high school students, so I can only anecdotes about the students that I have visited with, and so it doesn't necessarily speak for all. Some of the stressors and particular challenges that students face and parents may are related to academic success. So that we were at yesterday, students are concerned with how their grades will be able to master a skill or pass a test, or what that will look like for their college. We might have stressors that are related to expectations in the school. Students who participate in extracurricular activities, so the challenge competitive events and activities just brings another level of students. So whether it's band or clubs or sports or other extracurricular, that also brings a level of stress. Some students may be trying to balance academics, life, social relationships, work. So they have some different stressors that they experience. And then certainly I think what rises to the top is navigating social relationships. And where we have students looking for connectedness to communities, to just being in for who they are and accepted for who they are. I think oftentimes the fears or the worries are about not knowing what to expect. So early at the beginning of the year, because we might have students transitioning or moving to a new school. Students most often have a new teacher. There may be different students, and they're even thinking about being included in activities, or who will they sit with, that agreements with our friends, or breakups between teenagers. And who will they have as their supports in that peer network, as well as through tough times. So some of those unanswered questions, I think, really raise the stress level of youth. And as we know, in small amounts and with support from others, are to the challenge often and build resiliency. Yet we know that our youth also experience some struggles in problem solving or coping skills and by the academic or social challenges that they don't feel that they can manage or control. So some of the signs or changes in behavior that might indicate some unhealth, first, I think we think about sleep. So, and I mentioned earlier, an element of fatigue right now in that change in our routines, and stress definitely induce that fatigue. But with regard to sleep, is your student struggles getting to sleep or staying asleep, or maybe they sleep too much, seeing some changes in eating, perhaps a lack of appetite. I think that frequently in the school setting, and I know from parents that of headaches and stomach aches become one of those. So a person is struggling with meeting the demands of what's going on in their parents, and teachers alike may see some increased irritability or excessive. We may see some withdrawal from friends or from family. And so the mind, and those are some of the behaviors I think that are to us when we are paying attention and noticing. Hopefully our youth are comfortable in having those conversations, but when they don't have those conversations, imperative that we pay attention to how things are going for them, and that we have concerns. I think reach out and touch base with somebody. It's to talk to someone about your concerns, and if we're seeing that last for longer than a couple of concerns, with the lasting sadness or self-harm or any talk of suicide, we need to just as soon as possible.
Yeah, it's such an important point that you raised, Kris, and we're going to more into how to have those open, transparent conversations with your teen, with your kid about their mental health later. Before we get there, I want to open up the floor to you, Jayara. I think we can't have this conversation about mental health among kids and teens without the student voice in it. So I'm really heartened that you are here tonight, because I know that you and the Colorado do a lot of work to raise student voices across the state. I'm wondering if you can just share with us how the pandemic has affected your own mental health and what you're hearing, what you're seeing among friends and peers when it comes to their mental health and how they've been coping the last 2.5 years.
Yeah, for sure. The nose of the pandemic was very when the pandemic started. So I was looking forward to truly a couple of weeks closure of that chapter, especially as you news of single day. I think it's incredibly devastating to hear, find in a home, I just felt, and I felt super unsure about it. Was not a really great combination for some. My family just didn't know how the future would hurt us, so then that added additional stress. As soon as the pandemic dealt with almost online school and then hybrid schools of schooling, and ability in me, but also a lot of my peers as well. I had to make up for the time that we lost, especially my friends that were achieving people, and for college. Pandemic took that away from us, and now we have, and we never really got time to heal what happened. Became tired, and all of us eventually, we all still are burned out. It almost feels as if we don't have a choice and we have to keep going, and we don't really know. So definitely added additional, like I said, it took so much time we wanted to do and what we dreamed of, that we'll go now, and we cannot stop, and for enough. A lot of what I'm saying, we really don't know how to take our mental out because of the pandemic and how it'll.
Thank you, Jayara. I'm going to go back to Dr. Reynolds again, and I want to ask you about, we talked about all of these children who end up in the emergency department, but I'm curious where they go after that. And if you could talk about the resources that we have, and I'm just going to say the lack of resources. I also had a question come in from somebody who's watching about, the fact that it is extremely hard to find a counselor, one that takes private insurance or Medicaid, and what's going on in Colorado, and in terms of why can't we pay enough, reimburse enough through Medicaid and other sources so that more people want to go into counseling and see those patients.
Yeah. Great questions. So in terms of where kids end up after they're seen in the emergency room, it really can depend. And so sometimes, with higher concerns around safety, kids and teens will end up needing an inpatient level of care. So they are staying in the hospital overnight for a short period of time. That said, sometimes they do have to wait long periods of time for a bed to open up, so they're able to get that level of treatment. For other situations where maybe the risk is not quite as high, kids and teens might receive treatment at a partial hospital level of care or day treatment, which I think bridges that gap too. They're exposed to some of their experiences and like day-to-day life when they go home in the evening, but are still getting intensive treatment while they're in the program. Or folks can be referred back to their outpatient therapist, or we try and help them find a therapist once they've been seen in the emergency room. But that said, as you were mentioning, there aren't enough providers. I feel like with some of the initial spending that's moving in that direction, support from the state, there's certainly a lot of plans to bolster a lot of the existing systems that are out there. So that is definitely a good thing. However, yes, right now there is still certainly a lack of providers. And I think advocating to our representatives, to our senators, to our congressmen, this is something we need long-standing support for, not one-time dollars. This is not a problem that's going away. Mental health is not something you take Tylenol for. It is a long process of management and learning skills and implementing those over time. And we can't do that in an emergency room, right? That's why this long-term therapy is needed. And when I say long-term, I mean over time, not long-term forever, right? The goal of behavioral support and therapy is to help people build those skills so that they are independently using them themselves. But having the support to build that over time is something that we need lots of folks who are in this field for the long haul around. So I think that advocacy is really important in driving home on the federal level. This is something that is not going away and is highly, highly needed.
Jen mentioned earlier that a decade ago, schools were not responsible at all for kids' mental health. And now it's one of their top priorities. They're really tasked with making sure that students are okay. I know many districts, many schools start the school year with social emotional learning, and teachers just really emphasize that kids cannot learn unless they are mentally okay. Kris, I want to ask you what kind of prevention programs are in schools and how effective are these prevention programs?
Okay, sure. So I think there's on climate and culture to begin with, so that students feel safe, emotionally safe in the building. So at the ground, narrative to have positive climate and culture in a building and a place where people belong. And from the prevention standpoint, as you mentioned, social emotional learning, and schools use a variety of strategy curriculums to support that. A lot of that work is about teaching students skills, their self-awareness, to know how they're feeling and to be able to identify those, teaching some self-management skills. So learning how to cope is important. Also looking at social awareness and being able to recognize when are struggling and may need some additional care. And then just relationships, how we get along with others. I think that we've noticed that for sure. Adults say that coming back from the pandemic was different because a period of time where they practiced their social relationships skills. Just part of that SEL, social emotional learning, is making responsible decisions. The work that schools do, everybody has an opportunity, so they have opportunities to choose what those curriculums might look like. Our work center is to use evidence-based programs. That's important to us, and that we offer them. So if we're working with third and fourth graders, we're working with all third and fourth grade skills, and the same with high school or middle school. For instance, we use a few programs that might be known today. We use bottom life skills, Too Good for Drugs or Too Good for Violence, using teen mental health first aid, and have gathered a little bit of data to support the effectiveness of that. We also use sources of model of prevention, and we use that in the middle schools and high schools in many of our 10-county region. In addition, this year they are adding an elementary grade already, and excuse me, kindergarten through curriculum. So we're excited about that, and the possibility for schools to implement of strength for students in their building. And that also focuses on staff well-being. So that's a nice component as well. In addition, we also provide training for adults and who work with youth. So identification of students who are struggling. We offer through our center assist youth mental health first aid and counseling on access to lethal means. So for to make sure our community is informed, that they're aware, that they are able to identify having struggles, and then also to be able to make appropriate connections with. We definitely are looking at building students' skills, their ability to do some of that problem solving, but we're also working to sure that they have connections with trusted adults, connections with trusted, and that they have access to that. Also, many schools will do a screening to what trends they might be seeing for students in buildings or grade level. In doing that, they are able to offer some prevention work, some curriculum of a particular group of kids, or an entire elementary school. So effort on the needs of the population that are there and what's going on right now. We're excited about those opportunities.
Thank you, Kris. So you guys can tell we're having a little bit of video issues, I think, especially with Kris and Jayara. I don't know if it's possible for you two, but if you can turn off your video and just use your audio, that might make it come in a little clearer. We can at least give it a try. I wanted to direct this question at Jayara. There was a report that came out just yesterday that someone showed us that it was a survey of mental health and, middle school and high school students in Colorado. And one thing that surprised me in it, it said that 12 and 13-year-olds are more than ever reporting having bad mental health days. 3 out of 5 said that they had at least 3 poor mental health days in the last month. And it just makes me wonder about, where we're at in the conversation about stigma. And I think, I have 3 kids and they talk more openly about mental health than, we ever did when we were that age. So I wonder if some of this has to do with just normalizing talking about how your mental health is doing at school. So Jayara, I'm asking you how comfortable you are or you feel that your peers are in talking about those issues and in seeking mental health care, whether it's at school or, by talking to parents or doctors or whatever.
Of course. So I would say that there is not much on mental health with students my age, especially as it's becoming much more priority. And it's severe, and so we're seriously struggling. What's kind of how students are able to feel for each other, bad mental health, or you don't. A lot of peers who are able and talk about mental health, there's stigma. However, I do resistance will for mental health. Necessarily think there's stigma around it. I think awareness there for help. Stigma. Students are at talking about how they are. I think we're struggling with, and what's out of those resources provide us.
Thank you, Jayara. I think it's important that we keep the conversation on that stigma around mental health. And I know, Kris, in your adult parents are some of the most trusted adults for children when open and transparent about their mental health and how they're struggling. Hearing from students when it comes to relying on their parents for help with their mental health. And from your perspective, is there still a stigma among students when it comes to being open about mental health struggles?
Right, I'd be happy to. Position that I can speak to a lot of conversations that I have with students, a question in the best way possible. I think what I can reference is some information, and we do some pre and post with students who are involved in some of the curriculum. And what we know is students do identify family, spiritual leaders, trusted adults, sometimes teachers, and in the classroom can go to. I think that comfort, from what I can tell, in students talking to each other, and that is evident in, again, just this is nation, so I can't generalize it, but in this particular survey that did, they identify that they would talk to peers, about their own struggles that they might be having, or that they out to peers who they think might be struggling with some mental health issues. So they definitely are listing, and this is one community that identified family members as support in their life. Is there anything missed on that question?
I think that sounded great, Kris. Thank you. I think it helps a little bit with your video turned off, so I appreciate that. Dr. Reynolds, I want to go back to you, please, and focus this question on prevention. What tips can you give people listening here about how to stay on top of mental health? I know you mentioned earlier it's not something that you can fix with taking Tylenol, as you put it. It's a long process sometimes. So maybe start us out with, when you recognize these signs, what should you do?
Yeah. So I think there's kind of two pieces to that. One, there's kind of preventative, emotional communication, that when we integrate that into a family culture, the odds of kids and teens sharing can increase. So I think that's one piece where, if discussing emotions, if like healthy emotional modeling, that finding that sweet spot between, as a parent, we can be anywhere on the spectrum of showing a ton of really intense emotion or showing no emotion, expressing no emotion, but finding that sweet spot and in the middle where we're able to express what we're feeling, identify like out loud, kind of narrate some of our own adaptive coping skills. I think if that is embedded in the culture of a family or a community, that can be really protective. So that's one piece. The other is when it comes to particular symptoms and times that we might be more concerned. Other folks kind of mentioned I think it was Kris mentioned some similar layers here. The times that we might want to emphasize checking in with our kids more would be if we're seeing behavior change. So things like isolation, things like their interests suddenly shift or change, their friend groups might shift or change, could be completely harmless, but a good opportunity to kind of check in. And one of the ways that I encourage families to build this into what they're doing day to day is kind of setting aside, some people call it time in, but setting aside this enjoyable time to spend with our kids, which is harder with teens. But if we are showing up and being mindfully present, like in the moment, not judging our experience with our kids when we're doing something that they enjoy, that's going to increase the odds that when there's something going on, it might come out in one of those moments. Some families, have even said, wait, so I should play Minecraft, even though that's the last thing I want to do to help my kiddo connect and maybe share some of this stuff. And sometimes the answer is yes. For those short periods of time, thinking about how can I join with them, my child, my teen, whoever it might be, and connect on a kind of more enjoyable level. And from that, there's more space to talk about the things that aren't going well. So I feel like that's the groundwork when we think about prevention. And when we start to see shifts in behavior, we want to find things to join with kids and teens around where it might increase their likelihood of sharing more, right? Because they're seeing us interested, right? I think that sense of I'm sending a message that I'm interested in how you're doing and what you're into is really important, especially, you know, there's so many things capturing all of our attention, including our teens' attention. So I think having moments that message that is a really important piece of how we can be paying attention to if there's something that needs support, that needs intervention, if we're concerned about a kiddo's mental health.
What about, Dr. Reynolds, a follow-up to that, like social media and, you know, how much is this still affecting our kids and how much should we be involved in their social media accounts?
Yeah, that's a great question. I don't know if there is one good answer for that. But again, I think it comes back to transparency and building trust. So if we're concerned about our kids in any shape or form, we probably want to have more oversight. And I would, you know, recommend that folks kind of gradually build trust over time, you know, developmentally, right? So the same way that you have to have a learner's permit before you're allowed to drive, and then the restrictions on what you can do when you drive, I kind of think about that same process when it comes to other forms of independence, the internet being one. Of course, that could happen at a much younger age, but building that trust and having like potentially benchmarks for ourselves as parents to decide, okay, like they've shown they can responsibly do X, Y, or Z. I'm ready to give them a little bit more freedom. Because I think the 100% restriction can feel really difficult, but it also is a major outlet and social connection for kids. So it is a really tricky balance to strike. I think if we can find a way to engage with our kids on social media that doesn't feel strange, that might also be an avenue through which we can connect with them and know what's going on a little bit more. So it's going to feel different in each family, but those are some of my initial thoughts to that really sticky question.
A very sticky question. Thank you, Dr. Reynolds. I think it's important that we also get some advice from our mental health professionals for students here. Be so vulnerable to open up about your mental health and admit that you're struggling and that you need help. I'm wondering, Kris, if you can talk to us about some ways that students who might not know how to ask for help can start to open up and ask for the help that they need. Some advice on kind of some that they can take to be more open about their seek out help.
Yes, we encourage, and we've learned this from sources of strength and promote it, that reaching out to that trusted adult is a good first place. And so we encourage students in many of our training adults who they can trust, whether that's somebody in the school setting or a family member, it doesn't matter, but having a trusted adult that they can go to are struggling or they want to celebrate. So having that special person in their life. And what we hear though is that we do have some of our children and youth who haven't been able to adult. And so in those cases, we encourage them to talk to find out who their trusted adult is and to reach out to that person. And we know that the students, children, youth make between each other actually add to seek out help from others. We spend a lot of time talking about Say It Enough and how important that is and what an important role they play. And a trusted adult doesn't have to have the answers, but they need to be able to listen to the professional help that in seeking out additional care or treatment. And is that sometimes people are not just comfortable in reaching out to an adult and trusted resources. You mentioned I Matter earlier in this segment certainly is an option. Students can do that on their own. And as well, parents can do that on their student's behalf, on their child or child's behalf. We encourage use of hotlines, Colorado Crisis Hotline, or now we're able to use that 988. So we want people to access care in whatever way they can, a trusted source.
Kris, I wanted to ask you also, what happens after a student is identified as needing some ongoing mental health care in the community outside the school, and talk about, the struggles, I guess, in finding the resources that you need, especially in rural area.
And I think those were mentioned before, certain of local providers. But I do think the availability of telehealth and certainly having access to iMatter has been helpful. It is a struggle to find professionals. Our mental health center has prioritized youth in need. Medicaid, are certainly prioritized. So I think it's hard because we don't have enough staff in schools, and we don't have enough providers, and we don't have enough, provider community mental health center, and therefore we really have to build capacity standing and work diligently with our prevention efforts to support students in the areas that they are in. So whether that's faith-based communities or school communities or within our families, but that continues to be a challenge for us.
You a little bit more mental health support and resources are available at your school in Thornton. Resources widely used by students, helpful for students?
As of don't know a single person are mental health counselors. This is simply because we don't know what's going to happen, and we don't really understand how they are truly going. Are they simply there to provide us further help? These are just things that we do not go, especially was currently the district, and we only have 5 counselors for students. So you can see that it's very spread out, and we simply just don't have enough resources. Students don't understand what the resources are and how they will help. Prevents a block and prevents students from that help is here. It's kind of sad. Students just kind of this resource because we're just not aware its potential.
Thanks, Jayara. And Kris, I was wondering if you could address something that we've heard about, is that in some school districts, the student needs parental consent basically to get behavioral health care. Have you come across that issue or know how widespread that is in Colorado?
I do not know how widespread that is in Colorado. I know that it is up to each individual school district to determine how to pursue that, or what their policies say. about patient and consent from parents. So that is really up to the individual, their policy. I do know that there are some schools, but I can't speak to that require either consent or notification. So that definitely an obstacle for some student, and hopefully what we can encourage is that if in a particular school that they attend, that they can access mental health care, iMatter, or local community mental health center, where that legislation that changes the age of consent for youth will be accepted. I think the struggle is there is some conflict in the legislation of the federal requirements, and I think that's where that they bump in. That is the importance of the school policy.
Thank you. I want to raise a point in the chat. Our listener Jeff writes, the discussion seems to indicate that boundaries and guardrails are important, but it now doesn't seem to have a lot of boundaries. So how do we impose boundaries when peers do not have them? Kris, Dr. Reynolds, do you have any thoughts on that, this issue of culture and how we put some guardrails in place when?
I guess, just thinking about that question, and it sounds like you're thinking about how maybe Jeff is asking some about how peers interfere with what I just want to make sure I understand. But so I'm thinking about how peers potentially may interfere with mental health or treatment or being unsupportive. But I think some of the recent shifts and changes, I'm thinking about Safe to Tell as a really big support system where kids can and anyone can anonymously report concerns. And I think I've certainly, in my practice, so anecdotally, have heard of many folks either using that or ending up in a place where they get support because of a report that someone else made. So I do feel like there is some gradual culture shift around, how we are thinking about mental health as a community and as a country. But it's a slow grind. And I definitely feel like there are subcultures, right? In some subgroups of kids, including, some families, this is a really open conversation. And in other subgroups, it's really, really stigmatized to talk about these things. And what sometimes we think about for the folks where it's really, really easy to talk about, sometimes it can also become so much a part of an identity that it becomes its own concern. So all the more reason that we think about promoting healthy adaptive functioning across layers of how kids are engaging in their day-to-day lives, right? So extracurricular activities, hobbies, other interests, which of course all stopped during the pandemic. So again, I think a lot of the things that were potentially serving as prevention stopped, and that's part of what amplified an already broken system to begin with. And now we're gradually reintegrating into some of those things. So my hope is that we're trying to fix some of those problems that have been really highlighted by the pandemic, and some of the natural supports of teens helping other teens, kids helping other kids, and families being able to talk about these issues will weave back in as things become more and more open and we can engage more and more in the social world. I don't know if that answers the question, but those are my thoughts in response.
I have a follow-up for either Dr. Reynolds or Kris. I think, we can all look back over the last 2.5 years and tally up that we faced, from a global pandemic to mass shootings to social unrest and political turmoil. I'm wondering how we address these kinds of global events with kids. How do we be open about what's happening across the world in a way that will be constructive and honest without harming the mental health of kids?
That's a great question. Kris, I don't know if you want to take that or do you want me to chime in?
If you want to start, and I can do that.
Sounds good. Yeah, I think, yes, transparency is one of the things that is super important. And again, thinking about this healthy emotional modeling, if we are scared or distressed, our kids know it, even if they don't say it, right? So we are indicators for them. And so I think being verbally transparent and open about what we might be experiencing in a developmentally appropriate way, right? Thinking about what are they able to understand. That's really important when it comes to these big world events. Depending on the kiddo, right? Some kiddos may be much more worried about things in the world than others. And so we might have to change that conversation. But I do believe that avoiding it is how we end up in trouble. So finding ways to gradually approach these situations and acknowledge, yeah, this is really scary. Sometimes that empathy and that validation is the most impactful conversation we can have, again, with this message of helping our kids feel heard and seen. And I think that's a really important piece of this, because then if there's something going on, they're going to come to us as parents or to that trusted adult that they've already felt heard and seen by, because they trust that they're going to understand what they're saying. So those are some of my initial thoughts, but I'll pass it off to Kris.
I agree, absolutely. And I think our ability to be truthful and share a development with students only helps us. I think that the anxiety and from not knowing, not having the information from a trusted adult know is accurate. And what we have seen is that if we don't tell what's going on and the truth, that what they think is happening is inaccurate. And so through their relationships with how they share information with friends, and then what, potentially inaccurate, exaggerated view of something that's happened, the knowledge of what the supports are and who can be helpful to them, helpers are in the community who deal with some of these tragic events, even if only by TV or, the news. I do think that what we have is that it's essential information from us, that they get information from trusted adults and people who will, that creates the space then to come back and ask more questions.
Thank you both. As I mentioned when we first started talking tonight, Colorado is spending $450 million on mental health care. And we're running out of time here in our event tonight, but I just wanted to ask any of you or all of you about some, parting thoughts about solutions and in what very specific ways we could spend this money. And, looking at the continuum of, when you first have anxiety or depression or need a counselor, all the way up into Colorado has a shortage of psychiatric beds to put children if they need it. So any thoughts on those of you who've worked in this field for a long time in regards of where we most need to put in some reforms? Maybe Dr. Reynolds, you could start.
Yeah, sure. I mean, I think, as you kind of alluded to, prevention is one of the most important pieces, because that is going to help with down the road issues. And then we have the current issues of right now that really come back to where we need more money to bolster our workforce and make sure we have enough providers who feel supported enough to stay in doing this really tough work, especially when so many kids are struggling with suicidal thoughts, suicidal actions, and suicidal plans. It's really scary for everyone involved, and there's a lot of worry that goes into that. So I think supporting our systems with funding for workforce retention, recruitment, and then also thinking about education and ensuring that this is a field that folks do want to go into. I think that those are the key pieces that I notice. As much as we need right now that crisis level care because so many kids are in crisis, that is not the system we want to keep building. We need to be shifting away from this reactive system into more of this proactive, preventative system. Big picture, of course, we still need those things right now. So, so many different areas of need that we're noticing at the most acute levels of care, but then down to Medicaid providers everywhere in the community. Like that would be so lovely.
Kris, do you have thoughts about where you would like to see Colorado spend some money?
Oh, I can only echo what was just said. To mind too, as you were talking, Dr. Reynolds, we listened to Victor Armstrong, and he talked about that if we had resources that people could access, that we would to treat people when they are in need, and that we wouldn't raise to what we find ourselves in. So just I really appreciate it because this is my job right now. This is my work that I do, but also know that we need all of the to be available to people.
Very quickly, with one more question for you, Jayara. Again, it's so important to get the student voice in here. I just want to ask you if you think there's anything that I've been the mark on when it comes to kids and teens' mental health. Anything else that adults should be doing or should be aware of when it comes to you and your peers?
Yeah, really quickly, I can know what Dr. Reynolds, adults truly are for younger generations. Whatever behavior that they is what we will learn about all these things. Just they're things that eventually kind of figure out, and so I think we need to love themselves and mental health love for students and truly potential we could reach with mental health.
Thank you, Jayara. And that's to the very end of our event tonight. But this is by far not this conversation on mental health among kids of Colorado. Really a momentum point. I'd like to take time to tune into our conversation tonight. I'd like to thank our very informative panelists, Kris, Dr. Reynolds, and Jayara. And I'd like to thank our event sponsor, One Last Time Kids Crossing. You can coverage from the Colorado Sun on these very important mental health issues as they pertain to both kids and adults across the state. Both Jen Brown and I will continue to stay on top of those. You can also stay informed on our future events at coloradosun.com/events. Thank you, everyone.